In looking at patient resuscitation, okay, the various things that are actually involved in patient resuscitation, we looked at what is known as what we spoke about, like cannot intubate, cannot oxygenate scenario. Do you understand? So this scenario is quite a thing. Okay, so I just said let me just make a separate video about it and address it. Okay, so cannot intubate, cannot oxygenate scenarios, you just simply have to do it. Is the most feared emergencies. Okay, this occurs when conventional methods of trying to like secure the airway of a patient fails. So the patient cannot be ventilated, the patient cannot be oxygenated. All right, so the rate of oxygen supply to the organs of that patient is declining so rapid, so there's hypoxia, rapid one. All right, and complications of the heart are coming in, and if you are not fast about this, of course the person is dying, there's no oxygen. So what defines it? What will make me say a scenario is it cannot intubate, cannot oxygenate? You simply have to do it. You have tried to intubate but it's what unsuccessful. You have tried to ventilate but it's unsuccessful. All right, and you know the oxygen levels or oxygen stores in the body of the person are declining so quick, and there's no alternative airways. Do you understand? The only one is the front of neck access, which we'll be discussing. All right, they have to open this front, and it's a minimal surgical method. We'll talk about it. So causes and risk factors, like what could make a patient get into this situation where to oxygenate the person is almost impossible. If the person is so big, obese, facial trauma, all right, airway tumors, you know, physiological factors like laryngeal spasms, you know, airway edema, you know, poor preparation maybe from your side and the medical team, you guys didn't actually prepare well for this condition, you know. So management is what? Recognize it early. Do you understand? Because such a person is having little oxygen, you understand? So if you don't recognize it early, if you don't diagnose early, you might stand a chance of losing that patient. Okay, then you know, surgeons may come in for the front of neck access formation ASAP. All right, so that was it for this scenario. If you ever hear about cannot intubate, cannot oxygenate, this is just simply what they actually mean by it.